The views expressed in this podcast are those of the speakers and do not necessarily reflect the official position of MyPSA. This content is intended for educational purposes and reflects individual professional experiences. Hello, everyone, and welcome to MyPSA Future RX 2026, a podcast series by the MyPSA Advocacy Office. This series aims to support pharmacy students in gaining real-world insights into pharmacy practice, exploring career pathways, and preparing for their transition into the profession. Today, we are kicking off our very first episode where we explore the realities of transitioning from a pharmacy student to a practicing pharmacist and the aspects of practice that go beyond what is taught in the classroom. While we spend years preparing for the profession, stepping into real practice often brings new responsibilities, expectations, and uncertainties. The transition can be challenging as it requires not only knowledge but also confidence, judgment, and professional accountability. In this episode, we will explore the mindset shift and professional growth required as students step into their roles as future pharmacists. I'm your host, Zoru. Joining us today to help us navigate this transition is Mr. Jordan Chai Yew Fung, a pharmacist who has walked this path and seen the reality firsthand. Mr. Jordan, welcome to MyPSA Future RX 2026. Could you provide us with a short introduction, Mr. Jordan?
Okay, hello everyone. My name is Jordan, and I'm currently a fully registered pharmacist working in Pantai Hospital, Kuala Lumpur.
Thank you for introducing yourself. Mr. Jordan, looking back at your first few weeks on the job, what moment made you realize that real-world practice is very different from university?
Okay, so first few weeks on the job, real-world practice is very different when it comes to the actual workload, when it comes to the task dedication, when it comes to applying the knowledge that you have learned from your books into actual practices. So real life workload, as in like you have to have a good time delegation, you have to have good time management on things that are dedicated to you or things or responsibilities that are given to you on the spot. So real practice is more towards your own soft skills as well as the hard skills that you learn in university. So maybe I can talk more about that later on.
That's a very real transition to practice moment. It definitely shows how different things can be once you're actually out there compared to what we learn in the classroom. So, to the next question, many students worry about making mistakes early on. Could you share a lesson you learned from your first year that helped you grow as a pharmacist?
So I think this is a very interesting part of becoming a pharmacist in the very beginning of after you have graduated from university, is that you are afraid of making mistakes. And I think the lesson that I learned from the first year as a PRP is that you shall not be worried about making mistakes. Mistakes are the things that you really will get you into becoming a better pharmacist. So one of the examples that I really can remember is when I was a PRP, and then the checker, basically we have to pack medicines, and during packing we actually are very prone to making mistakes because we are not sure what the medications are, and there were many doses available. So my very vivid mistake that I can remember was Bilaxten. Is ODT 10 mg and 20 mg. So there was the first time I took 10 mg, and then the checker, which was the last stage of packing, the checker would call my name and then say, "Oh, you actually took 10 mg for me. I wanted 20 mg." Then I took again 10 mg in maybe 5 days' time. That time I could remember very clearly. The checker itself was like, "I thought I told you that this mistake 2 days ago or 3 days ago." So it really reminded me very clearly that this mistake, every single time when I took Bilaxten, I remember there was this time where I made mistake, and also there is a different dose in Bilaxten very clearly. So what I'm trying to say is making mistakes is something that is normal, and we shall not be afraid of doing it as a pharmacist, especially in your first year.
Thank you for being so honest about that. So, to give us a clear picture, could you briefly walk us through your current role and the setting you work in? What does your typical day?
So my current role currently, because I was after my PRP as an FRP, I was chosen I was given an opportunity to enter clinical, so clinical pharmacist. But before that, because I had to go through a training before I enter, so now I'm currently a floater. So a floater is basically a person that does not have like a specific place to stay in after your PRP, after your 1 year. So you're not sure where you're going to stay in first. So I'm mostly floating around in inpatient pharmacy. So my typical day basically revolves around as an inpatient pharmacist where I could be given a role as a transcriber or charger. Charger is basically what we call the first point of contact with the prescription, where the prescription came, you are the first person to receive it, you're the first person to transcribe everything and also to screen the prescription. And you're also maybe given the role as a runner or a packer. Basically, you do those packing things, pack the medications, because in private hospital, we pack into plastic bags individually. So we receive a prescription, we charge, and then the prescription has labels. And after that, the label will be clipped together into one stack, and the stack itself is placed somewhere. So that stack itself, the packer would take the stack and then start to pack. So those are the works of a packer. And I will also be given a role as a checker as well. So basically, I had to like check all those things that I said just now, from the person who charged, the person who packed, see is there any mistakes or errors that are made throughout the way. So other than all these like typical processes inside inpatient pharmacy, we also had to do DD, dangerous drug handling, as a pharmacist. So with the time constraint, maybe I'll just walk you guys through very quickly. Dangerous drug, we consist of just receiving, like we will receive a whole lot of dangerous drugs from because we would order them and then they'll come in bulk. Then we have to receive it and enter into our stock room. Then we would have to bring the DD out from one location to another, perhaps from the store to the inpatient or other locations as well. And we also have to do check and found. So check and found, basically we have to look through if the transactions are correct on the book, inside the system, and also physical. So these are basically what I do on a day-to-day basis in an inpatient pharmacy. Yeah.
Thank you for sharing that. It really gives us a clearer understanding of your day-to-day practice in that setting. So moving on to the next question, was there a specific experience that changed your perspective on your role as a pharmacist?
So, specific experience that changed perspective on my role. I feel like at first I was very nervous to enter as a pharmacist, but eventually I realized that the specific experience that I had was I saw many mistakes that were made by doctors, and that itself made me realize that hospital pharmacists actually plays a very important role in ensuring there's no mistakes being given to the patients or even the nurses that are serving the medication. So the specific experience is that when I saw doctors prescribing a very high dose, I couldn't remember the exact experience itself, but it's like more towards day-to-day basis. You can see experiences of where doctors prescribed things. I'm not entirely like putting the blame onto the doctors. It's just maybe their practice is different from us. So we as a pharmacist, we have to screen through, and that itself changed the perspective as a pharmacist, where you will start to see the role of a pharmacist playing vitally in a hospital. It's not just us packing the medications. It's not just us preparing the medications, but we are also serving a purpose inside the hospital as a being to make the healthcare to the patient better.
Incredible how this specific experience can teach us more than an entire semester. Those high pressure moments aren't just obstacles, but they are the building blocks of the pharmacist you have become today. That turning point really highlights how different the real world is from the safety of a university lab. Now I want to dive into the heart of our discussion. Let's peel back the layers on what an internship actually looks like versus what we see on social media or in brochures. Mr. Jordan, many students see an internship as a period of observation or passive learning. In reality, how quickly are interns expected to move from observation to active responsibility in practice?
Okay, so if I want to talk as a PRP's perspective, really 1 to 2 days time is the buffer time as a PRP to observe. And after the 1 to 2 days time, you are actually given an active role to do things inside the hospital. So based on my experience, that time when I first entered into the private hospital, it was just 1 or 2 days time where we were just observing people, see how do they do packings, see how do they do charging. And after a while, we started given roles as the packers. We started given roles as to handle the DDs. We started given roles to bedside dispense. All these just comes very quickly once you become a PRP. So if you are an intern and if you want to, or if you are going to become a PRP soon, in reality it's very fast. You won't be passive learning so long. You would just enter into the role as soon as you are there. But I'm talking as a private hospital perspective, because I'm not bashing private hospital as well, but because private hospital takes you as a head count. It's not as like government hospital where you are there to just wander around and learn. Private hospital, you really have to be somebody that works there. So you really have to ensure that you do something and not waste the head count that they have given the place with. So yeah.
That is a really important point to clarify. It definitely helps set the right expectations for students who are preparing for their first real experience in this field. So next up, since we have discussed clinical skills, but what about the emotional side? What aspects of the job require emotional resilience and how can students prepare for that?
So emotional resilience, I feel like, as per my experience, is more towards working with co-workers. That really requires emotional resilience for me, because you are new there, so you're expected, or maybe they treat you very foreignly when you enter. So you got to have this emotional resilience, or to say you have to be able to adapt quickly into the environment, and also at the same time manage your emotions well, because at first you'll feel a bit out of place. You'll feel like you do not belong there, and you will feel like people are treating you differently. So what I want to prepare those newcomers into PRP, into a new environment, is that definitely you feel a bit imposter syndrome, but it's fine. As long as you manage your emotions well, you tell yourself that you are there to learn, you are there to make mistakes, You are there to understand things, how it works eventually, and you are not perfect. You are not going to be good at first. Then you allow yourself to make mistakes. You allow yourself to, get people not liking you. It's fine. Okay, as long as you understand what your purpose is, you understand that you are there to learn. That's all. Okay, and also remember one thing is I always tell myself, if you're so good, then why don't I just become the pharmacist? Why don't I just sit at your place as a pharmacist? If I'm so good, of course I'll make mistake. If I'm not making mistakes, I'm not a PRP. So I told myself that then that's how you prepare yourself. Yes.
That is a really important area to cover. It's one thing to have clinical knowledge, but the emotional side of the job is something you can only truly understand once you are in the middle of it. So moving on to the next question. What is one habit students can start early to prepare for practice?
Okay. So if you want to talk about hospital pharmacists, one habit that you can start early is I'm talking about the role as a hospital pharmacist. I'm not talking about retail or into pharmaceutical companies because I'm not too sure about what habits they have. But as for me, I think the habits that we should have as a hospital pharmacist is always keep updated to the clinical knowledge. So if you're a student and you are about to enter hospital, it's very important that you get your fundamentals correct. You understand every medications. If you don't understand, then try to find it out. But a habit that you can do every day is try to look something up and read, or perhaps revise something that you have learned previously. Ensure that your mind, your brain is always working so that it's not, your brain don't get lazy of the knowledge, eventually forget everything. That's what I do. Even like before the interview, I was still studying. So it's like it's more towards your day-to-day practice to accumulate the amount of knowledge that you have so that when you are in the pharmacy, you don't feel inferior with the medications. You see the medication, you know, oh, this is the dose. Oh, this one renal impact cannot use. Okay, this one I need to check G6PD. So it's like it just is your fingertip knowledge. That's how you can become very good.
It's good to be aware of those habits now. They might not be the focus of our exams, but they are clearly essential to the workflow. So I also wanted to ask, beyond checking pills, what does your daily workload actually involve beyond dispensing medication?
Beyond checking pills, I also deal with a lot of patient questions. If I dispense medications, patient will ask a lot of questions, and we have to pick up the calls. So nurses will ask you questions. Doctors might ask you questions, and you might have to call doctor to ask questions as well. So if you encounter a prescription and then you see the medication is not right, the dose is not correct, the frequency is not correct, or sometimes like because we're inpatient, we have to know the quantity to supply. So if, for example, I give you a scenario, maybe you cannot think now, but I can give you a scenario, for example, that we see every single day. It's like the doctor might prescribe noradrenaline for a patient, okay, but the doctor did not write the run rate. Okay, so run rate is like mils per hour. A doctor did not write 0.05 mcg per kg per hour. So we cannot calculate the amount of noradrenaline and pills that we can supply. So we have to call the doctor. So this is one of the enquiries that we have to do beyond just dispensing medications. And we have to deal with nurses. Nurses will call us whether the medication is ready or not, because some are urgent medications that we have to fill it up very quickly. Some are just, PRN medication. So other than checking pills, other than dispensing, there are this little trivial stuff that you also have to handle on a day-to-day basis as an inpatient pharmacy. As for outpatient, it's more towards private hospital, checking GLs. GLs is guarantee letter. So whether or not the medication is covered, whether or not that medication itself, the patient can afford. If the patient cannot afford, does the patient want it? Does the patient want an alternative? So these are our patients' perspectives. It's a little bit different. Yeah.
I don't think any of us saw that coming. It really shows that being a pharmacist is not just a problem solver. It's just not a scientist, but also a problem solver. So, in your opinion, what responsibility surprised you the most when you first started working?
What responsibilities? When you have to deal with doctors. Because doctors, you can know that pharmacists' role is towards the medication, but doctors might sometimes not. I'm trying to find a word so that I don't, sound wrong, but it's like doctors might not understand you at first because they do not see where you're coming from. Okay, so the responsibility that you have as a pharmacist is that to ensure patient safety, sometimes you have to like make sure that the doctor understand you, but at the same time, it's like within a quick second because doctor do not have that much time to talk with you. You cannot talk the pharmacology, talk the mechanism of action. No, nobody will listen to you. So how are you able to convince the doctor in a split second that he or she wants to listen to you and change the dose that you noticed it was wrong? So that responsibility itself is very critical because what if the doctor do not want it and you know that it's wrong? So the patient might be in danger. So in that way, if you want to convince the doctor, you would have to sound convincing and you would have to, do your research, make sure that your evidence are solid enough to convince the doctor itself. So this is like, I myself feel like in inpatient pharmacy or even in clinical pharmacy, it's really important that you consolidate your evidence-based practice as a pharmacist, and that's part of your responsibility. When I first started working, yes.
Sounds like a large portion of the day is dedicated to ensuring clear communication between different departments to keep things running smoothly. Today, we have learned that the jump from student to practitioner isn't just about knowing more science. It's about a complete shift in how we handle accountability and people. We often think of an internship as a waiting period before we become real pharmacists. But as Mr. Jordan shared, the internship is where the real pharmacist is born through pressure and practice. Before we wrap up, I want to pull out the gold nuggets for our listeners. If you are a student and you are wondering, what do I do with all this information? These next few points are for you. Mr. Jordan, instead of just trying to survive the posting, what mindset shifts should students adopt to grow during their internship?
So you have to have this mindset where, like I said in the beginning, you are there to learn. First thing, you are there to understand things and get things right at the end of the day. Second, you are there to make mistakes, so it's fine. You are grounded to be making mistakes. You definitely will make mistakes. You will definitely make like a serious mistakes as well. So you don't have to be 100% prepping yourself for things that you cannot predict. There's no use at all. Just make sure that your mind is clear and your emotions are steady and ready enough for you to solve problems. And fourth thing is always be prepared to solve problems because there will be a lot of problems arise. in one go sometimes, and you might not know how to prioritize. But the mindset shift that you would have to have is don't run away from problems when it arises. If that's your responsibility, you take it up, you own it up, you go and solve it. Find ways to solve. If cannot, find your preceptor. If you really cannot, you think of eventually there will be a way, okay? And it's not the end of the day. So most important thing is you don't feel afraid. You don't be afraid of the new challenges that's coming up as to become a PRP.
I like that shift in focus. It turns the posting from something we just have to get through into a proactive opportunity to build our professional character. Next up, what is one practical step students can take this week to prepare for practice?
Okay, if you're talking about becoming a PRP or an intern in a hospital pharmacy, one practical step is you can start to get good rest. Because getting into PRP is more towards emotional and physical drainage rather than getting your knowledge right, because you would eventually get your knowledge straightened up during the practice, because you are just dry reading the knowledge, but you haven't seen a real scenario yet, so you are not applying the knowledge as much. So you don't have to like worry about, is my preceptor gonna ask this question, blah blah blah. You don't have to worry about all those. More to do is to prep your mind that everything is gonna be fine. I think probably you can listen to podcasts of how you can handle emotions is something that I did, where because other than just going with your preceptors, there are a lot of co-workers that you have to communicate with as well, especially those very, very experienced co-workers. You are a very new person there, so you are expected to face challenges from them. So just prep your mind, get your emotions correct, get your self-esteem back. Don't feel out of place. Just go into it and go with the flow. Yes.
Appreciate how doable that is. It gives us a way to start preparing for our future roles without feeling overwhelmed by everything we still have to learn. Moving on to the next question. If you could give students one essential people skill, what would it be?
If people skill, I would think that good listening skill is very important. Other than just being able to communicate, a lot of times I saw people dispensing. You don't really listen to what patients say. I think in your practice, in your university, you do see they emphasize this a lot, but a lot of times I saw a lot of pharmacists, they don't listen to what the patients want. They're just jumping to conclusions. Maybe sometimes patient does not want the item itself. He wants your attention, or he wants your empathy, or he just feels like he's not seen. Sometimes, like when you encounter that problem, the person itself seems angry, seems harsh towards you. Maybe you can tone yourself down. That's when they feel heard, feel seen. Then they will start to slow down the pace. Yeah, I think that's a very good skill that you really need to learn when it comes to practicing in a hospital.
Very fair point. We often prioritize science, but as you have shown, being able to communicate effectively with patients is what actually allows that science to work. So, The last question would be, how should a student handle the anxiety and uncertainty when a doctor or patient asks them questions on this?
Even now, I experience the anxiety after a year. So the anxiety itself won't stop. So it won't stop just because you have become an FRP or become a pharmacist. It won't stop. You just keep going. So are you gonna always feel the anxiety and the anxiety to haunt you every single time? No, you take it as something that galvanize you. You take it as something that makes you more serious towards the question or things that they ask. So for me myself, I feel like the anxiety is just because I'm unsure. So if you're unsure, that means you haven't prepared enough. And if you haven't prepared enough, then you prepare more. That's how you handle the anxiety, the uncertainty that you experience. So on the spot itself, you cannot solve it. It's okay. You just go home and prepare more. And you will still experience anxiety more and more. Then you know where you are lacking off. And that's how you improve.
That is a very realistic concern. It really shows that being a professional isn't about knowing every single answer immediately, but about knowing how to handle those moments with honesty and the right resources. Today's conversation has shown that workplace readiness is about adaptability rather than memorization, giving students a head start in real-world practice. Thank you, Mr. Jordan, for sharing your experiences and providing such honest insight into the realities behind the white coat. We would also like to thank our audience for staying with us until the end of this first episode. Now it's time for the MyPSA Future RX mini contest. To participate, answer the posted questions in the comments below by 4th of May 2026. By participating, you will have a chance to win 3 tickets to the MyPSA Advocacy Dance Workshop 2026 through our Spin the Wheel Lucky Draw. Winners will be announced on our MyPSA official Instagram page. Make sure to submit your answers before the deadline. That's all from episode 1 of MyPSA Future RX 2026. If you enjoyed today's talk and want to learn more and hear more about the world of pharmacy, make sure to subscribe and follow us on MyPSA's YouTube, Facebook, Instagram, and Spotify. We'll be back soon for the next episode where we'll explore different pharmacy pathways and what your career could really look like. Thanks for tuning in and stay inspired as you head into your next shift.